Today we're going to be talking about how to properly care for your Essix retainer. Tip number 1, don't lose it. If you're someone that's been recommended by your dentist to wear your retainer throughout the day, you always want to bring your protective case out with you. You never want to leave it folded on a napkin, leave it on a dining tray, and you definitely don't ever want to toss it in your purse or throw it in your pocket. Doing these things is going to severely increase the chance of your retainer either being thrown out or getting damaged. So always bring your protective case whenever you're leaving the house. Another thing I want to mention is if you have any pets at home, especially dogs, they are very attracted to that sort of translucent, shiny material. So always try to keep it out of reach from when they're going to be able to get their hands on it. Tip number 2, how to avoid damaging your retainer. A lot of my patients end up damaging their retainer by the way that they are cleaning it at home. So I just wanted to give you some easy ways that you can clean your retainer from the comfort of your house. First thing I'm going to say is every time you pop off your retainer, always give it a nice rinse under water. We always want to make sure we get rid of all the saliva on our retainers. Another thing is if you are trying to clean it with something a little bit more than just water, I recommend using plain old dish soap. Use some dish soap, work it in with your fingers, and that's the best thing you could be doing for, you don't even have to be doing this daily, but if you want to be doing it weekly or you feel like your retainer is starting to smell a little funny, that's what I normally recommend. If you are looking for a deeper clean, something to possibly disinfect your retainer, maybe you just recently got over a cold, I recommend making a combination of half water, half white vinegar, submerging your retainers there for tops 15 minutes, and then once the 15 minutes are up, take it out, give it a nice little rinse with some dish soap just to get rid of that kind of vinegar smell and taste, and you are ready to go. Some things that you want to avoid. You never want to clean your retainer with toothpaste. Toothpaste is way too abrasive, and what it's going to end up doing is causing scratches all along your retainer that's only going to make it easier for bacteria to build on your retainer. Another thing you want to avoid is you never want to leave it submerged in harsh chemicals such as mouthwash or hydrogen peroxide. Over time, those harsh chemicals end up eating away the plastic of your retainer. Another thing that I get asked pretty frequently is if I recommend those over-the-counter cleansing tablets. There's a lot of tablets out there used for retainers and for dentures. I typically don't recommend those tablets anymore. They have a lot of harsh chemicals that end up building up in your retainer. So every time you wear your retainer, you are exposing yourself to those chemicals. So I try to stick away from recommending those. And tip number 3, the most important tip, if you take nothing away from this video, take this. Wear your retainer. Please, please, please. I promise you, if you don't wear your retainer, there's a really high chance that your teeth will shift back, and we want to avoid that at all costs. If you're watching this video and you go to try to put on your retainer and you see that it no longer fits, bring it to the attention of your dentist. Let them know, hey, my retainer is not fitting anymore. We're happy to take a look and see whether we just have to make you a new retainer, or if we notice that a lot of shifting has occurred and you're interested in what your options are, we're happy to go over that with you. There are a lot of things out there that can try to quickly fix some relapses, and sometimes you may just need treatment all over again. But I hope that these tips were super helpful, and if you have any other questions on how to properly care for your retainers, leave a comment.